Hey, this is Doug Field along with my co-host Ron Bachman, and welcome back to this segment of Healthcare Consumerism Radio. You know, in our first segment, we talked about account-based plans, defined contribution, and, you know, the consumer's movement to those type of plans. But the complete solution for employees themselves, employers, cannot be totally addressed without an effective health management program that really helps their employees and families live a healthier life. And joining us to talk about that is Dan Cave, President and CEO of Nurtur. Dan, good morning.
Good morning. How are you folks?
I'm good. Dan, good to talk to you. It's been a little while.
It has been a while, but it's great to hear your voice again.
Yeah, nice to talk to you. Give our audience a little background around Nurtur, and then I'd like to get into this discussion about healthcare, less about health, and it's about life, which I really...
Sure. First of all, I think your introduction related to the trend in the industry, I think, is very important, because understanding Nurtur is certainly best understood in the context of the environment in which we're all operating. And certainly the trend towards consumerism is something that continues, that has been going on, of course, for years, is being accelerated by the development of marketplaces and exchanges. And by my way of thinking, and I think by many's way of thinking, what's happening in healthcare is very similar to what happened in retirement plans and pension plans years ago, where there was a similar trend toward consumerism, and it's kind of known as 401ks.
Yeah.
And as 401ks came into place and consumers were asked to do more in terms of making their own choices, of course there arose a whole industry around helping people with those choices. And Nurtur we call ourselves a behavior change company, and it's really precisely because of that same trend occurring in healthcare, where as individuals become true consumers of healthcare, their health, their underlying health status becomes increasingly important. And as we all know, health behaviors are a key determinant of one's health status. And so our focus is really on managing or helping people manage their own behaviors that change their trajectory for where they are headed in terms of their health status and ultimately healthcare costs in the future.
Yeah. Dan, you know, every consumer in a workforce population, because we're really talking about, you know, health plans and employers and their members and employees and their families, everyone's different. Everyone's at a different place in the continuum of managing their health. So how does Nurtur meet each one of them where they are?
Great question. And certainly the core premise of consumerism is that the services that are provided will be unique to that consumer and will meet that consumer's needs. And quite honestly, I think in the healthcare world, if you think about it, I would say that healthcare is probably an area which has not really progressed in terms of meeting consumers where they are. You know, if you think of all of our experiences going into a doctor's office, we're asked to fill out forms and then wait. And in fact, we sit there and wait. And if you went into a retail store and had that experience, you'd probably not like that retail store. So meeting the consumer where they truly are, I think, is incredibly important. And for the business that we're in, which is really providing those behavior change services, meeting them where they are involves really a couple of things. First of all, it involves how we engage with them. And secondly, it involves with the what part of the engagement. What do we engage with them on? And so, first of all, in terms of how we engage, historically that has been done telephonically. There was probably an era when it was done face-to-face, where we do experience some back to the future, if you will, as it relates to that, where we are increasingly finding clients who want us to provide health coaching services in a face-to-face environment, physically in the workplace. But the core approach, the core modality has been telephonic over the years, and we see that changing markedly now as we explore and further deploy technologies. So increasingly meeting them where they are, may be not face-to-face, may not be on a telephone. It may be some form of electronic modality where the coaching services are delivered through. That coaching can be delivered electronically either asynchronously via some type of secure messaging format or secure text format, or even synchronously. For instance, we are deploying increasingly use of video technology so that we can do face-to-face synchronously in an electronic means and not have to physically be in the same room, if you will, as the person we're coaching. So that's the modality side of meeting them where they are. But the other element of meeting them where they are is, as we think about changing someone's behavior or helping them change their behavior, there's really three component parts to that. There's educating them, sort of teaching them on the right thing to do. Mm-hmm. Secondly, there is understanding that their priorities of their life, the environment in which they live, is a key driver of those behaviors. Said simply, if someone is dealing with a divorce or a child who is having difficulty in school, that tends to take priority over eating properly or getting their exercise in or monitoring their blood sugar or whatever their health-related issue might be. And so the third component of behavior change is motivational science and kind of the science behind getting somebody motivated to make change. And meeting them where they are in terms of how we do it is really assessing an individual on those three component parts and then providing a service that meets their most pressing need as it relates to those three component parts. So if we attempt to talk to somebody about pharmacotherapy of their lipids, their their hypertension, and they're dealing with some emotional issue mm-hmm. in their life, it's very difficult to enable them to focus on their health if that emotional issue is taking precedent now. And so instead of saying to them, just sort of trying to educate them more on why they should do what we're talking to them about with respect to their health, we really need to be prepared to address that life issue that they might raise to us. And we really need to be prepared to find out what motivates them personally, individually, not what motivates some very large segment of the population, but what moves them emotionally to change a behavior. And being brutally candid, I think our industry has a long way to go. We are not perfect at it. We are mm-hmm. good at it, and we are getting better every day and investing heavily in it. But that's really what we have to do. Each intervention has to be personalized to that individual.
Dan's Ron Bachman here. I think that that's a striking way to describe it, and I think a very appropriate way about education, understanding, and motivation. I think it is a lacking piece in many services that just provide different ways to help address problems but don't get to some of the underlying causes as you're trying to do. How do you do that and maintain the issue of privacy? And how open are people with the kinds of connections that we have that may not be face-to-face or eyeball-to-eyeball? How do you elicit the kind of information that the individual may not even know or appreciate that's driving their behaviors?
So it's a great question, Ron, and I will tell you that you don't do it by being prescriptive with the individual, right? So. Right. Unfortunately, I think years ago our industry felt, I use the Field of Dreams analogy, right? For those of you who have seen the movie, if you build it, they will come. Well, my analogy there is if you tell them, they will do it. Well, they won't, right? And so being prescriptive is clearly not the right way to do it, and I think our whole industry learned that years ago. And so how you get them to expose to you these really root cause issues is all about engagement and motivation and motivational interviewing. It's all about the training that we do around a coach who must be in a position to immediately impart to the participant that there is value to the conversation. We've all received inquiry, if you will, from someone who is attempting to get us to change behaviors, right? The classic one is the telemarketing phone call. Right. And none of us want to, we all answer that phone and go, oh my gosh, how am I going to get off this call? And frankly, that's the issue we all face, whether it's over the phone or whether it's a text message or whatnot. And so we have gone through extensive investment in training our staff on the psychology of getting people to engage and to ask open-ended questions and very careful, specific open-ended questions that allow people to very quickly decide whether there is going to be value in this conversation or not. Another simple example there is when we do engage with a member, we are incredibly respectful of their time right up front. Mm-hmm. So we're not, the poor individual on the other side of the engagement intervention or interaction isn't feeling like, okay, this could go on for a half an hour, right? They're feeling like within a couple of minutes, we will be very respectful of their time, and if this isn't working for them, we will drop it. And the improvement in our engagement has been incredible since then. And I would say that it's hard work. I also would say that technology holds great promise to assist in that as a tool. I think the jury is still a little bit out on whether technology can sustain behavior change, but certainly it can get us started. I for one, feel personally that my smartphone certainly has helped me sustain behavior change because I compete against myself, but with many of the apps that I have loaded on it.
Well, what I'm hearing you say is that relationship to your clients, you have to quickly develop a level of trust. They have to trust you in order to open up, and it sounds like that's what you would try and do. Not only let them see the value, but they'll see the value and be open to it if they feel there's a level of trust between you. Now, what I really appreciate in the way you describe your organization is this idea of it's not about health, but it's about life. At the Institute, we've talked about that as really at the leading edge where not that many companies are out there, and so it's wonderful to sort of see the industry and organizations like yours begin to move into areas we actually call our fifth generation. We talk about it going from health to longevity, so that if you can convince people it's going to help your life and be more productive and live longer and happier, that's a real key that we really haven't tapped into, and you're starting to tap into it. Now, I know we're running out of time, so let me pass it back to Doug to do a little wrap-up and see what the final points are that you want to leave the audience with.
Yeah, Dan, we've got about a minute and a half to go. I'd like to allow you some time to kind of wrap this up and leave our audience with some takeaways.
Sure, Doug. Thank you. I guess, I look back on where we've been and where we're heading, and it strikes me often now with over 30 years experience in the industry how much I have to learn and how much we all learn every day. And I leave you with a simple vignette that early on I used to think this was an education business, that what we needed to do was teach people what to do, and of course they would do it. And as I listened in on our coaches' calls, and I would hear the people that we speak to, that we work with, say to us, "I know." They kept saying, "I know," and then they would say the word "but." And after the word "but," usually came something we were ill-prepared to deal with, because the "but" was something about their life. Yeah. It was, "I know, but. I know I'm supposed to eat better, but. I know I'm supposed to exercise, but." And I don't think our industry acknowledged that "but." And it took us a long time to do that. And we went out and took a pretty big risk. We acquired a work-life EAP company because the work-life EAP industry knows about those things that come after the word "but." And I think the thing that really does set us apart is we are tangibly trying to blend those capabilities, to blend that health management capability that comes from a diabetes educator with the ability to deal with what comes after the word "but" from what is typically considered the work-life EAP industry. And we call it people management and people care.
Hey, Dan, we got
Nurtur people care.
Yeah.
So hopefully that helps.
Yeah, I really appreciate it. Sorry to come up to a hard stop, but I really appreciate you joining us. Have a great weekend. I look forward to talking to you again soon. The rest of our audience, stay tuned for the next segment of Healthcare Consumerism Radio.